This is Brandon with Chiropractic. Today I want to talk to you about a patient that came in my office. He's about 80 years old and he came in with some lower back pain. And he said, you know, my stenosis is acting up again, or my stenosis is causing my pain. And while that may have some validity, what I'm finding is he had a stenosis for years. And that what we know from this low back pain cycle that we see here is that low back pain is a continuum. It depends on their activities and their postures and the things they do on a daily basis that causes their pain. It's not their stenosis or their DJD. You know, we see asymptomatic disc problems and facet problems all the time. There's no correlation to structural problems as they relate to pain. So we have to make sure that we understand the continuum of lower back pain, that we start with an insult. And that insult is the repetitive stress. It's the posture. It's the trauma that we put on our back. Those are the things that we need to attack as chiropractors, learning how to bend properly, learning how to sit in your chair properly to avoid going along this continuum and turning into maybe a disc problem later on. If that disc problem isn't treated properly, or you never correct that functional problem as far as sitting or bending, then it turns into degeneration maybe later on in life. And if it's still not corrected, it turns into stenosis and all the problems that happen along with stenosis. So if we don't actually correct the problem, which is why something happens to begin with, then we're no longer going to be treating patients. We're going to be treating them for pain here and there when they come in. As a member of Chiropractic, you're going to have access to all these functional diagnoses and what we do to help those patients. Don't forget about making orthopedic diagnosis. That is very important to get somebody out of pain and get them on their way. But if we don't tell them why it happened in the first place, I believe we're doing those patients a disservice. They're going to be more satisfied with their care if not only do we get them out of pain, but we keep them out of pain.